Hey everybody, my name is Alfredo and my partner AJ. We're going to be demonstrating a standard chest x-ray which consists of a PA and a left lateral shot. Alright, so before you even get started, what you want to do is you want to make sure that your room is nice and clean, organized and free of anything that might actually be, a obstruction to the patient. Make sure it doesn't look like there was a procedure just done here. You want to go ahead and detent your machine to 72 inches for a chest x-ray, and make sure you have it nice and set, which you can set, and your marker ready to go. So here we already have it lined up and we are just waiting and going to get the patient. So let's go ahead and do that, alright? To set up your initial technique, go to the control panel and select PA chest. Also select your wall bucky setting, as you will be using the wall bucky. As if you are an AEC, take it off into your fixed technique and adjust your technique on a range anywhere from 120 at 2 to 120 at 4 as the initial starting point, and make adjustments once you see your patient. Alright, so now we went ahead and retrieved our patient. We have the requisition here. What you want to do is you want to make sure you always double ID your patient with the full name and the date of birth to make sure you have the right patient. Get an accurate history as well, so you know why they're here and the reason behind this chest x-ray. It'll help you in the long run and give the radiologists and the doctors a full idea of exactly what is going on. So here's my patient, Mr. Clevenger. So, Mr. Clevenger, can I please have your full name and your date of birth, please?
Sure, it's Arsenio Clevenger, July 7th, 1983.
All right, and what brings you here today?
I'm having a little bit of trouble breathing.
Okay.
That's the only problem.
All right. I see. Do you have any history of smoking or high blood pressure at all?
Yeah, I smoke a lot.
Okay. All right. So, I mean, it's always good to just ask these little questions here. If my patient here was a female, of course you would want to ask if there's any chance of pregnancy. Would there be any chance of pregnancy?
No.
No chance of pregnancy?
No.
All right. That's always good. So just make sure you ask, just to double check. You want to make sure you have your shield here ready to go. You always want to make sure you shield your patients properly. And all right. So sir, please, if I can have you switch into this gown. And with patients that come in with shirts like this that have graphics and logos, you want to make sure that they remove them. You never know if they might show up on the x-ray or not. Make sure they don't have any necklaces. If my patient today was a female, then make sure to remove everything from the waist up, including the brassiere and anything like that. But sir, go ahead and put this gown on with the back side open towards the back. Perfect. Alright. There you go. Sir, may you please stand on this board here facing the wall. You go ahead and stand them here. You want to make sure they center them. I'm going to take this hat off. Look at that. Beautiful. You want to go ahead and center your patient to the bucky. And we already had this preset, so it'll make everything run by smoothly. You have your left marker outside of the anatomy, marked on the left side as well. So go ahead and relax your shoulders, sir. Perfect. Thank you. You want to make sure you center your ray as well. Make sure not to fall like I almost did. Make sure you center your ray at T7, which would be more roughly at the bottom of the scapulas. You want to follow your center line down the center of down the mid-sagittal plane, bottom of the T7, and patient center right here. You want to make sure you give yourself a little bit of room as well on the shoulders. Make sure you include all the anatomy. Now, sir, go ahead and wrap your arms around the board here. You're going to roll your shoulders inwards. And rolling the shoulders inwards is very important. It'll get the scapulas out of the way, out of the lung field, and give you a full clear shot. So I'm going to place a lead shield behind your back. Please do not take a step back. You might trip. There you go. Now we had our technique set as well. I had it set at 120 kV at 4 mass. This was before I saw the patient. I can make any quick adjustments once I see him. I think I will leave it at 120 at 4. Before you shoot it, always make sure to keep an eye on your patient just so they don't move, alright? So sir, go ahead and roll your shoulders in. You're good. Take in a deep breath for me, please. and hold it. And then you shoot it, and that is your PA chest x-ray. Alright, so our second shot is going to be a left lateral shot, which you have your patient facing you. The left side is closest to the board, and the x-ray beam will be coming in at a transthoracic, I guess, way from the right side to the left. So you want to make sure you do, for him, we're going to do a portrait view. You adjust it, slide it in. Adjust your beam as well, so you have him. Let's see, sir, go ahead and take a few steps forward, just until you feel my hand here. There you go, perfect. Make sure that he is nice and centered. No rotation as well. For a left lateral shot, I like to lower my bucky and my tube just slightly, a few inches. Make sure you include all the anatomy. Don't cut any of the costophrenics out. That typically happens. Always shield the gonads as well. So go ahead and bring your arms up. You can, there you go, perfect. Behind your head and bring them close. If they're unable to do that, you can always use a tube like that. You can always use one of these they can grab onto it. Go ahead and grab onto here, just demonstrate. Perfect. Or you can always use a IV fluid pole for any patients that are having a hard time bringing their arms up. What this does is it goes ahead and brings this part of the arm out of the apices of your lungs and gives you a clear shot. So you have them centered here. We have adjusted, brought our tube down. You want to make sure your marker's on there as well. We're still marking it to the left. And there you go. So on a lateral shot as well, you want to adjust your technique slightly by doubling your mass accordingly to the patient. So, because you are going through more anatomy, you want to make sure you double it. So sir, go ahead and take in a deep breath for me, please. You can move out of the way here. Deep breath and hold it. Don't move. Go ahead and breathe and relax. And that's going to be our lateral chest x-ray. You want to take your cassette over to the reader. Nice moves. There it is. Scan your cassette. Feed it into the reader. Give a little sexy smile, and you're ready to critique. Alright, so now that we have our image up on our screen here, we're going to go ahead and critique it. So what you want to make sure you include in the anatomy here is going to be your apices. Make sure you do have them on here as well. Don't cut the costophrenic angles on the bottom here. You want to include your diaphragm as well. You have your air-filled trachea coming down the middle. Your clavicles here are equidistant from each other and out of the apice field. Your scapulas are out of the way, which is why we rolled our shoulders inwards. That brings them out of the lung field, which gives you a clear shot here. You want to make sure that there is no rotation of the body as well, so that you would be able to tell with rotation. If you had your sternoclavicular joints weren't matching up, then you would more than likely have rotation of the patient. Your marker is on the left side of the patient, which is anatomically correct, and your heart is coming this way on the left side of the patient. In some cases you would have it coming down the other way, but in this case it's on the left. So that's pretty much what you want to look for. 8 to 10 ribs as well, yeah. 8 to 10 ribs. Ribs are good.